Hello, so after our initial video talking about how to go about booking your lameness investigations, we decided to do a couple more videos explaining what to expect when you actually book your lameness investigation here at Brooke. So we're going to show you what stages of a lameness investigation will we go through and what sort of information are we collecting from them. On this first video, we're going to be focusing more on the gait evaluation, so showing what sort of information we collect from trotting the horse on different types of ground, and both on a straight line and on a lunge. While on the second video we're going to be focusing more on the most interacting part of the lameness investigation, where we actually do flexion tests and nerve blocks with your horse. So hopefully by the end of it you're going to understand why are we doing all of this with your horse.
So the first step will purely and simply be asking the horse to trot up in a straight line in hand with the help of our nurses in a way and towards us. Initially on a flat concrete surface. On a few occasions we will also do it on a soft ground, and as a rule of thumb, when the horse is moving away from us, we will be paying more attention to the movement of the pelvis and trying to detect any asymmetry between one side and the other, which will usually indicate a hind limb problem. When the horse is moving towards us, we will be paying more attention to the movement of the head, trying to spot any head nod, for example, and usually that will indicate a front limb problem, being that the horse will raise the head when the affected leg lands on the ground and drop it when the sound leg lands on the ground.
Okay. So one of the steps that we will always gonna do when performing a lameness investigation here at Brooke is seeing the horse on the lunge, on the arena, on the soft ground, usually on a wider circle, and we're gonna be comparing the right rein with the left rein. That will allow us to flare up certain types of lameness. So usually, for example, and as a rule of thumb, it's not always the case, soft tissue pathologies tend to be more aggravated or more pronounced here on the soft ground. That's because there's more muscle effort being applied, and the ground is more uneven and gives away, which makes it so that certain fibers within the ligament or tendon will be more pulled than others, and that will aggravate the pain, if there is pain in a ligament or a tendon. It will also make a difference whether we see the lameness on the leg that is on the inside of the circle or on the outside of the circle. Again, for example, a soft tissue pathology tends to be worse, and again, not always, when the affected leg is on the outer part of the circle, because that leg travels more and it spends more time in suspension, while, for example, bone or joint related pathology tends to be more aggravated when the leg is on the inside of the circle, because it bears more weight, and it also tends to be more aggravated on the concrete, where the impact is higher and it's not dispersed and being absorbed by the soft ground. So those are some of the informations that we will gather when we are seeing the horse being lunged, left rein compared with the right rein, and soft ground initially, and then compared with the concrete ground that we're gonna do later on. Right. So now here on the concrete, we will be also lunging the horse to both reins, usually on a tighter circle, and this is a much more stressful test per se for the horse. It takes much more of a toll on them. Usually lamenesses that arise from joint or bone related conditions in which the impact is the problem will be more aggravated here, or pathologies within the foot, even if they are soft tissue related. And that's because, as we are asking the horse to do a tight turn in a concrete ground that doesn't give away like the soft ground does, obviously, as soon as the foot hits the ground and the horse tries to pivot on that foot, the hoof itself will be locked in place, locked in the ground, and the only thing that will be moving are the soft tissues within the foot. So the lamina, the DVFT, all the ligaments within the foot, the podotrochlear apparatus will be just twisting ever so slightly, like your foot would inside of your shoe. If you lock your shoe on the ground and you try to pivot, you will feel your foot just sliding ever so slightly. The same thing will be happen inside the horse's hooves. So if there is pathology in there, usually this torque will increase the pain and it really takes a toll on them. Most horses, however, will be more tentative to lunge on the concrete. They are not used to it, so we always need to be a little bit forgiving and with them, because even a completely sound horse might be very tentative trotting on this type of ground. Okay, so this terminates the first part of the lameness investigation, and we're going to show you the next part on the next video that is to come.